All right. Hey guys, how are you? Just going through some of the comments here and our channel on our website, and a good question came up about ESR CM. How do you manage reusage? And the reciprocating file, what is the protocol for discarding, given the Wave 1 Gold is single use? All right, so as we know, Wave 1 Gold files have this expanding kind of a handle that prevents you from reusage, and that was certainly a an option to do that, to prevent people from reusing files. But with the ESRCM, we decided that it's not a good option. People have the ability, should have the ability, to choose for themselves if a file has been used and overused, or it should be discarded. Clearly, the manufacturers all recommend single use for all files because of the matters of safety and, of course, the legal type of recommendation that's involved in there. And of course, we all know ourselves that since cyclic fatigue and torque is insidious, you cannot see it on the file, that you should really remove and discard files after single use, especially if they've been kind of really worked hard. But we can also appreciate that, first of all, not only these files do cost a good amount of money, at the same time, in some cases that are simpler, such as the anteriors and some of the premolars, they don't really get that work that hard. And there is no such thing as how many cases before you toss a file, but more how many canals you should do before you toss a file. And in my personal opinion, and my clinical usage in my practice, I use a file in 3 canals. So if I'm doing a molar, I will end up using with 3 or 4 canals. I end up tossing that set of files after a molar, because I do feel like getting down these molars, especially in the mesiobuccal canals and so on, does work the file enough that there is that insidious cyclic fatigue that has been kind of pushed into the file, and I don't know when it's going to break next. But if I'm doing an easy anterior or premolar, then I feel comfortable to reuse them, and that was really the reason why ESR CMs are resterializable. These files are not like Wave 1 Gold that can only be used once. They can be re-sterilized. But the recommendation of the manufacturer is to use them once. But my recommendation personally on a clinical basis is to use them for 1 molar, or if you're doing an easy anterior or premolar, use them twice. So that's going to help but cut down the cost to half in those cases. And in molars, then you end up having also the most important things to have safety. So you always open a brand new set of files if you're doing a molar. If you have an anterior or premolar, you can use a brand new set of files on that, but then you can sterilize it. But the key here is that that only gets sterilized once in a package. So when you have yourself a new case that's a molar, obviously use brand new files and then toss them. But if you have a non-molar case, then take a look at your repertoire of sterilized files, because those have been used only once before, and then you use those and then you toss them afterwards. So what's a good way of developing that system? Well, it's pretty simple. I use the endo ring, as you know, and I love this little device. And I would use the files when they're on top. The ones that are on top are good, because the assistant doesn't know which files should be tossed or not. After I'm done with it, the ones that I don't like, I would put on the side, and the assistant will know that these files that are on the side need to be tossed and not sterilized. And then whatever is left on the system can be re-sterilized. And then you can also put 1 line here on the foam. That means it's been sterilized once. And then after that sterilization cycle, that is tossed. And again, you get that 1 sterilization on the foam, and those files are done. And I find that this idea of being able to use the files in 3 canals, which ends up being 1 molar or 2 anteriors or 2 premolars, is a good balance between making sure that you get your safety as well as having a simple method of sterilization and triage for your assistants to keep track of, without you having to keep track of each individual single file in a very different manner. So files that get sterilized in your office once can be used once and then tossed, and then everything else is used brand new from your set of files. I hope this helps you out. It helps you out to maximize your safety and efficiency. Don't confuse your assistants, as well as be able to save some money. And this is the way I've been doing it, and it's worked out fine. And I hope it works out for you as well. All right, guys, I'll see you in the next video.